Well, welcome everybody. So I'm going to, in about 10 minutes, briefly overview the study. The study aimed to update growth charts on weight, height, BMI, and head circumference for Hong Kong children. It was funded by the HMRF back in 2018 and involves the departments at CUHK, Hong Kong U, and the Department of Health. These are the co-investigators. So Professor Patrick Gift from Hong Kong U, Thomas Chung from DH, Patrick Chong from DH, Simon Lam, Shirley Leung, and Dr. Connie Hoey. We also had an expert advisory group who were very important in terms of guiding us through the study, particularly our overseas experts, Charlotte Wright and Tim Cole, and also our local advisory groups from the David Chow from the Hong Kong College of Family Physicians, Bill Chan from Hospital Authority, Jacqueline Ho from the College of Community Medicine, and Sophie Leung from the College of Paediatrics. The study was in 3 phases. The first phase was to review existing data and decide whether we move on to the second phase. And then the second phase was to actually conduct the growth study. And the third phase was to design new charts and to get stakeholder feedback. So the first phase confirmed that there was a definite secular trend in height and that new growth charts were desirable. So this is just a snapshot of some of the data that we analyzed from the MCH, comparing it with Hong Kong 1993 charts, the WHO charts, and also the China charts from 2009. We also showed very clearly that in the children over 5, from 6 to 18, there was a clear secular trend. We also did a previous study at CU on from this age group in 2005 to 6, which also showed the same secular trend. So with this, we proceeded to the second phase, which was to conduct a cross-sectional study, and we did this between May 2020 to October 2022. We enrolled subjects from birth through to 20 years, 1 private hospital, birthing hospital, 1 public birthing hospital, 6 MCHs, nurseries, kindergartens, primary and secondary schools, 5 vocational schools, 3 universities, and 1 NGO that had a number of sites across Hong Kong. And here are some of the pictures of taking these anthropometric measurements. We had some clearly defined standard operating procedures to make sure that the staff were very well trained, to make sure we measured the body weight, length, height, and head circumference using very standardized methods. And we had training in terms of whether we should round down and what we should do if there was differences between the measurements. And at below 2, we measured length. Above 2, we measured height. These were inclusion criteria. So we did actually enroll all kids at the schools, but when we analyzed, we just analyzed those with at least 1 parent of Chinese ethnicity. They had to be full term. And if measurements were very sort of out of range, we excluded those measurements. So birth weight, we showed that the babies in the private hospital were born slightly earlier and lighter. So we oversampled from this hospital. So we had to make some adjustments for this based on birth weights and gestations across Hong Kong. We also, if there were multiple measurements, we used the average. And as I said, for under 2, we added, so for under 2, we subtracted 0.7 centimeters for length, and above 2, we added 0.7 centimeters for height if the length was measured. So we had all this data from a large number of samples, and we then proceeded to see what stakeholders wanted. So we had a number of focus group discussions. And the way we did this is we reviewed charts from a number of jurisdictions, including Hong Kong, mainland China, Taiwan, Singapore, Japan, Korea, Saudi Arabia, Norway, Germany, UK, Ireland, New Zealand, Canada. And we looked at the features of these charts, and then we presented a PowerPoint to 11 focus group discussions, which had a total of 89 participants, and they shared with us what features they would or would not like. Obviously, not everybody agreed, but there was a general consensus that people liked a chart from 0 to 2 years, and then a chart from 2 to 20. 9 centile lines, which was also a recommendation from our expert advisor. Make sure that the charts could be printed in black and white. A lot of people want automated charts, which will be possible with the data that we've collected. And also, there was a lot of requests for mid-parental height comparator. So we made a total of 8 recommendations in our final report, and I'm not going to read these in detail, but we did test the WHO 2006 growth standards from 0 to 5 and showed that these would be suitable in Hong Kong, but also the Hong Kong 2020 charts from our new data would also be suitable. But there were caveats from both. So if we use the WHO charts, the older children were slightly shorter. And if we use the Hong Kong charts, we should really start at 38.5 weeks rather than 40 weeks, which is the mean gestation in Hong Kong. So we then recommended that both WHO and Hong Kong 2020 can be used for growth monitoring, depending on what the individual users want. Healthcare providers and organizations really have to decide what they want. And we do have a combination chart, which is both WHO from 0 to 2 and Hong Kong 2020 from 2 to 18. And as part of all this, very important that there's good education. I won't go into this recommendation in any detail, but we had a lot of discussion about how to define overweight and obesity, and we concluded that we should use BMI cutoffs, and this is what WHO and others are recommending. And our last 2 recommendations were that we should maybe look more closely as to how we define growth faltering. Currently, people use the NICE guidelines, but this may not be suitable in our setting. And also, there should be regular surveys to monitor child's growth going forward, and this potentially could be done by the Educational Bureau. So I'll stop there and hand over to Dr. Connie Ho, who's going to give you a bit more details about some of these specifics.